This is a 65-year-old female with seronegative RA who's been followed by her rheumatologist for the last 10 years and has been on methotrexate, low-dose prednisone, and a biologic drug, a TNF inhibitor, for control of her RA disease activity. The clinician, in addition to routine physical exams, has been following this patient with Vectra because he had noticed that her CRP was always normal despite having clinically active disease, and had 4 repeat longitudinal values on this patient to assess her molecular disease activity. On exam, her disease activity appeared to be well controlled, and the physician noted that her Vectra test had gone from 44 to 40, and wasn't certain whether or not this was in fact a significant change or decline. It turns out that changes in Vectra scores of under 8 points represent biological variation and do not indicate that the patient is either getting better or worse. In order to interpret the Vectra appropriately in terms of getting worse or getting better, the Vectra test must change by greater than or equal to 8 points. So in this particular instance, the change of several points downward represents biological variation and does not represent a true clinically meaningful improvement in disease activity.